Once again, welcome back to obstetrics and gynecology videos. Today, we are going to see psychosocial and cultural aspects in pregnancy, psychological, social, and cultural aspects of pregnancy. We know that pregnancy is a period of growth. Complete change will occur in the maternal body. Her size will increase, her abdominal size will increase, she will gain the weight, and she will get a lot of changes in her body, especially seeing the skin changes. And of course, it's a challenging period for the mother. Along with these changes, she will be having fear related to the outcome of labor. She will be having tension how to take care of the baby, what will be the process of labor, whether it will be painful. Such tension will be there for the mother, and the same feelings will be there even for the father also. They also will be having anxiety and tension about the child, about the delivery process, everything. And actually these changes, how it is affecting the couples, it depends on the age, health status of the couple, socioeconomic status, and cultural background, and even the societal support. All those things will affect the psychosocial or psychological aspect of the mother and the father. In the first trimester, immediately after diagnosing the pregnancy, the lady will go to a stage of ambivalence. Sometimes introversion or narcissism will develop, and later they will accept the pregnancy. And this is a period where they need maximum emotional support from the family members and even from the society also. Ambivalence means they will be in a confusion whether to have a child now. Especially this will occur in the case of unexpected pregnancy. That is, if the pregnancy is not a planned one, they will be having tension whether this pregnancy and delivery, will it affect my job? If they are studying, will it affect my studies? How my husband will accept this pregnancy, whether it is the correct time for us to have a baby, whether my body will cope with the delivery changes. All this tension will be there for the mother. At the same time, that stress will be there. At the same time, she will be having a feeling that okay, I'm going to become a mother. That happiness also will be there. So she will be in the middle of both. One side tension will be there, and at the same time happiness also will be there. So a conflict will be there, and that is the ambivalence actually. And they know that the pregnancy will cause permanent changes in their life because they are going to be a mother. So they will be named as mother after the delivery of the baby. And especially in the primary gravida mothers, they will be having, that is, if it is a first pregnancy, they will be having high stress about the child care, whether they will be able to take care of the baby, whether they will be a good parent. Such feelings will be there. But if you are coming to the multiparous woman, the tension will not be related to that. It will be related to the care of first children, especially if the gap between the pregnancy and the first baby is less. Surely they will be tensed about the care of first baby, whether the baby will accept this newborn baby, all those things, whether it will affect the relationship between the first child and the mother. All this stress will be there for the woman. And next is introversion and narcissism. Introversion means that doesn't mean that she will become an introvert. That is, she will start to concentrate on self and on her own body more. That is, she will select the food items, but she will be so selective, even in her dress, even in her chappal, even in her dressing sense, even the food selection, everything will change. She will start to take care of herself in a different way. And if it is a primary mother, they will start to look at the pictures of baby, and they will be more eager to hear about the stories related to the baby, infant, all those things. If they are not having this tendency prior, they will develop it during the time of pregnancy. And in the case of multiparous woman, that is, if they are having already a child, they will be concerned about the acceptance of the siblings. So they will be looking for the articles related to that, sibling rivalry, such things they will be focusing more. And narcissism means undue preoccupation with oneself. That is known as the narcissism. Next is acceptance of pregnancy. Finally, the lady will accept her pregnancy and accept her transition of lifestyle. And a woman who cannot accept the pregnancy will find it difficult to accept the changes associated with the pregnancy, and even she will get difficulty to adjust with the newborn after the delivery. Being a health personnel, it is your responsibility to assess the acceptance of the lady. When you are assessing the acceptance, you have to see the following factors. That is, you should see whether the pregnancy is a planned pregnancy, that is, whether it is a wanted pregnancy or not. It is wanted for her and for her partner. Both things you are supposed to consider. And you should see whether she is happy or not. Sometimes she may tell that, okay, it's a wanted pregnancy, I just want to continue, but she may not be happy. So you should see that. And you should see the discomforts. If she is having the complaints of discomforts, even for the minor discomforts also, if she is exaggerating and if she is telling frequently such complaints, it shows it may be due to the non-acceptance. You can suspect the non-acceptance in that case also. Next, in the second trimester, towards the second trimester, role assumption will occur, and it's a period of self-image and body image changes during the pregnancy, and maternal role attainment also will occur. In the role assumption, actually she will start to adjust or adapt to the roles as a mother, but actually it's a process, it will take a long time, but slowly and gradually she will start to adjust, and psychologically she will be able to adjust with the changes in her body, and she will accept she is not going to be a girl no more, she is going to be a mother. Her identity itself is going to get changed. Slowly and gradually she will accept with all these things, her identity change, her physical change, her emotional change, her role change, everything gradually she will accept. Next is self-image and body image during pregnancy. We know that it's a period of sudden change in the body. Even your body posture will change, your weight will increase, your abdominal size will increase. So you have to, psychologically, it's a transition period for the mother, and you have to see the transition role of the mother in the ideal self, in the self-image, and in the body image. The ideal self means what is expected. That is, it composed of all the attributes and qualities and images a person would like to have and hope to include the self. So I just want to be like that, I just want to be lean like that model. Such concepts will be there. That is that ideal self. What is her expectation about herself? And self-image means at reality what she is. That is self-image. Sometimes she may be lean, or sometimes she may be fatty, all those things. In reality what she is, that is the self-image. And body image means these are the changes that is happening during the pregnancy. That is, perception of her size is there, her movement changes, her physical activity changes, her beauty will change, she may feel as like she is looking ugly. Such things are coming under the body image. And next is maternal role attainment. Finally, she will attain the role of a mother, and she will start to acquire her maternal role gradually, and she will prepare herself for taking care of her infant. And for the first time mothers, really it will be difficult, but they also will start to do such things. Some will start to prepare dresses for the newborn baby, for the upcoming baby. Some will start to make arrangements for the baby at home. All these things will be they will be doing once if they have accepted the role of a mother. Next, we can see the changes in the third trimester. Usually in the third trimester, they will be having more anxiety related to the labor preparation and about the maternal role, and they will be having lack of knowledge due to this. Due to this only, they are getting this anxiety, and they will struggle, or sometimes they may develop a relationship with the fetus, and they will start to develop fantasies. They will start to see or dream about their coming baby. In the traditional period, that is, if you are thinking about the olden time, majority of the families were joint families, so they were getting adequate explanations and they were getting adequate role models from the family itself. They might have seen someone as pregnant, and they might have gone through this, they might have seen all the changes and all the care, or all the things which are happening in the life of a pregnant lady. But nowadays all the families become nuclear and they may not be having such an exposure. Sometimes they may not have even seen a pregnant lady at their own home. So in that case, and at home, they may not be having anyone to ask for the suggestions or ask for advice. So it's a struggling situation. So because of that, they may take time for changing their role. And the same process may be there even for the father also. So it's a responsibility of a health personnel to teach them about it and clear their doubt. And actually this learning process, it's a long-term process, and the health personnel should do it with long patience. They should use the effective materials, they should focus and they should concentrate on the problems of the mother. So they have to do it, or they have to plan it in a perfect way. Next, establishing a relationship with the fetus. See, once if she is able to establish a relationship with the fetus, after the delivery, it will be easy for her to start her bonding or start her relationship with the infant. But in case if she fails after the delivery, it will be difficult for her to accept or start a relationship with her newborn. Next, dreams, fantasies about the pregnancy. They will start to experience, or they will start to dream about childbirth. They will start to think about or dream about newborn baby, and they will start to dream about the life of a new mother. And they will start to think about the sex of the baby. Sometimes they may get some fears also. If I'm getting this female baby, or if I'm getting a male baby, such things may come. Or if my baby is getting some abnormalities or some problem is there, what will I do? Such thoughts also may come to their mind. Anyway, they will majority will start to think positively, and they will start to do the dress rehearsal for themselves, and they will sometimes they may start to prepare dresses for the newborn, and sometimes they will do all the arrangements at home. At the same time, they will be having problems or thinking or fantasies about the problems that might occur during the pregnancy or during the labor process and after the delivery also. So such things also will be there. So they will start to dream or think about positives and negatives. Next, cultural aspects in pregnancy. In the cultural aspects, mainly we should think about the diet. Actually, a lot of myths are there related to the diet which can be taken by a pregnant lady. In some cultures, they will restrict certain type of food, but some culture will encourage that same food. So a lot of taboos are there related to the food, and usually they will restrict some of the food items, and they are considering some of the food are unclean, and ingesting such foods will produce undesirable physical characteristics for the baby. Such myths are there. And some will not give crab, chicken, some will not give egg, rabbit, and these people, they are believing that it will harm the appearance of the baby. And some will not take a hot food because they are thinking that a pregnancy is a hot stage. And some will not take milk products or cold, or some will encourage that. And some are believing that the hot food like chili, ginger, and other animal products will produce the abortion, or it may produce even miscarriage or fetal abnormalities also. Some are believing like that. Next, about the activity and rest. See, in some culture, they are allowing the mother to do the daily household work, but at the same time, they won't give sternness or hard work, all those things. Mild work will be there, and they will be giving, encouraging rest at home also. And even about the sexual activity also, some are restricting the sexual activity from the first month onwards. It depends on the culture, but some are not at all having any restrictions, and some will be restricting from the second trimester onwards, that is from the second half of pregnancy onwards. And even in the postnatal period also, such restrictions are there. Some are restricting the mother to the bed for 90 days. Some are restricting the mother to the bed for 28 days. So continuously the mother has to be in bed for 28 days. They won't allow the mother to do any type of work. Just she will wake up, she will take her food, and she has to be in the bed for 28 days. But in some cultures, they are not at all thinking that it's a period of sickness or it needs rest. They will allow the mother to do all the household activities. Normally it will go like that. But in some cultures or in some religion, they are considering the postpartum period or the period after delivery is a period where they are not supposed to participate in the religious activities, and they are considering this newborn baby and the postnatal mother as a unclean something, and they are having a habit of ritual cleansing of both mother and baby. Then only they are supposed to take part or participate in the religious function. Such custom is also there. Next is about the preparation for the birth. That is also varies from custom to custom. In some places they will make arrangements. They will make arrangements like they will make bring a cradle, they will make dresses, they will even select name for the baby, everything they will do. But in some cultures they are having a belief that if they are doing such things, previous preparation, or if they are searching for the names, all those things, it may produce some malformations or some problem for the baby. The fetus and mother will be vulnerable to evil influences. Such beliefs are there. So these are the major psychological changes that will occur during the pregnancy, and these changes actually will occur for the mother and for the father also. So thank you for watching this video. We'll be meeting soon with a new video. Bye.